Hey, Dr. Rob Williams. I'm pleased to interview you virtually for the Future of Healthcare Conference 2020 on digital living, promises and perils of communication technology and social media. And thanks for participating for our last panel, which is the Changing Internet and the Future of News and Media. We're doing a pre-recording right now since you aren't able to join us live. In fact, you were supposed to be in Nepal right now at this point, right?
I'm really missing Nepal, Amber, but so good to be with you. So much promise, so much peril.
That's a good way of saying it. Well, I'm pleased that we can actually record this interview, even if it's for like the fourth time or third time. Was it?
We've had a lot of practice.
We've had a lot of practice.
Yeah.
So I'm really pleased that we're doing this, so your
Me
perspective
too.
will be included in the panel.
Thank you.
Yes. Well, you're a really good friend, and I'm happy we're making this happen.
Me as well.
Yeah. I'll start off with introducing who you are. So, Dr. Rob Williams is a media educator, musician, historian, consultant, and journalist in Vermont with a focus on major media systems and propaganda. He is the founding president of the Action Coalition for Media Education, ACME, and publisher of VermontIndependent.net. And let's begin the question, shall we?
Yeah, let's jump in, and I back at you. Let's do it.
And we thought we would shake it up and ask you to choose something in your home that kind of feels like it reminds you of our current media system.
We built many years ago a hot sauna, a little shack, a steam room, a hot box. And just this past winter, we brought in an ice pool next to the hot box. So the way it works is, and I hope you'll both experience this when you visit, you get in the hot box for 15 or 20 minutes and you sweat in the heat, and then you immediately come out and you jump into the ice cold pool, and it's a shock to the system. And I feel like that's a great sort of metaphor for our digital media culture right now. I feel like when I'm getting kind of the official version of events, I'm often confronted with a lot of fear and a lot of, dare I say, propaganda, and it's hot and steamy and almost unbearable. And then I come out and I jump in the ice pool, and there's this shocking moment of clarity, and my whole physical and mental and spiritual system reboots in the ice.
Wow.
And then I go back and do it again. And that's kind of how I feel about our 21st century digital media culture. It's this really interesting kind of hot and cold intention all the time. So that's my Vermont winter homestead metaphor. And media, by the way, plural of medium, media refer to storytelling environments. So we've never before as humans moved through as powerful a media culture as we have today. Like the sauna and the ice bath, right? We're constantly sort of having our system kind of shocked. And there's a couple things to flag here. One is, one way to think about all this is to think about two trends in tension. The C trend, which is has to do with sort of corporate, commercial, centralized media, and then the D trend, which is the opposite of that. It's sort of decentralized, diverse, small d democratic media. And these two have never before been in more tension than they are now. And typically what happens is people think about red versus blue, or left versus right, or liberal versus conservative, whatever those terms mean. But I actually think that the better framing is this kind of C versus D. We live in a media culture in which we are programmed for polarization. And my favorite example is looking at YouTube, which is owned by Google, which is owned by Alphabet. So if you go on YouTube and let's say you search for a Donald Trump video and you watch said video of Donald Trump, rather than YouTube serving you up kind of differing perspectives on that same sort of topic, right, what you get is more extreme Donald Trump. And that's by programmed algorithmic design. I go by search for Bernie Sanders, same thing. I get more extreme versions of Bernie Sanders rather than maybe complementary or even differing perspectives from this particular Bernie Sanders video. And that's a deliberate decision by programmers at YouTube, Google, Alphabet to give us more, they like to say, of what we want or what we say we want. So we're literally being programmed for polarization. We're being pushed into tribes. Mm-hmm. And then the other thing that's going on that's very interesting is as we're being pushed into tribes, we're seeing official narratives or official stories amplified, and other versions of events that might question or wish to discuss or debate official narratives, they are deplatformed or censored or pushed to the margins. Mm. We have a challenge before us. And the challenge with the coverage of the coronavirus pandemic is to take a deep breath, first of all. Step back, see the different strands of this particular pandemic story. There's at least three, there's many more, but let's just say for the purposes of simplification, we have what might be called the geopolitical strand of the coronavirus story, one. We have the public health strand of the coronavirus story, two. And we have the media and information strand of the coronavirus, three. So think about those three, geopolitical, public health, and media strands and how they connect. And let's be very clear that this is a very scary time. We're getting our information about the coronavirus in the United States from a couple of very powerful sources with vested interests in the outcome. Critical Media Literacy 101 teaches us that there is no such thing as a neutral, objective source. And the three sources that have been providing us with most of our information about corona are, number one, this will not surprise anybody, the World Health Organization, right? The WHO. Number two, the Center for Disease Control in Atlanta. And number three, Johns Hopkins University, which is responsible for that moment-by-moment kind of data compilation about corona that inhabits the TV screens, right? 24/7 of CNN and MSNBC and Fox and the Post and the Times and the et cetera. Let me be a little provocative here, and then we'll open it up. Because the World Health Organization and the Center for Disease Control and Johns Hopkins University are not objective neutral players. Do your research, figure out who's funding those organizations, figure out the history of those organizations and their own kind of complicated past. And then you might ask, why are we letting these three organizations drive the official narrative without opening up the story and the conversation and the news to other doctors and virologists and epidemiologists from around the world who have other interpretations of the data? U.S. hospitals have been asked by the Department of Health out of Washington, D.C. to COVID code people who are dying, ostensibly of COVID, even if they have comorbid symptoms that may have complicated their end-of-life scenarios beyond COVID. For example, if I have heart disease or emphysema or obesity or I'm immunocompromised and I catch the COVID and I die in a hospital, the Department of Health has asked those docs to code my death as exclusively COVID, which means the COVID numbers keep going up, even if I had comorbid symptoms. So this is a huge story that should be reported, but is not. And last thing, Sweden and Taiwan are two countries who have made different decisions about how to account for the COVID. And they haven't locked down their populations. They've tried to isolate their most fragile populations. And we're learning that they're actually doing okay.
You know, we talked about this in our last attempt with this interview about the importance of just having dialogue so we can really be open to other perspectives, what other people are looking at, not just one. I mean, last time we talked about how YouTube CEO Susan Wojcicki, I think. She yeah, she released a statement saying that she would ban any coronavirus video on YouTube that didn't align with WHO guidelines, right? So that's an example of censorship there, as you talk about. And also you had an example of Twitter, right?
Yeah. And I'm glad you're bringing this up. Yeah, Twitter just announced, I think yesterday, that any tweets exploring the possible relationship between the 5G 60 gigahertz telecommunications rollout and coronavirus will be banned from the Twitter platform.
Wow.
Because they said, and this is where it gets interesting, they are conspiracy theory.
Interesting.
When you question the official coronavirus narrative, suddenly you are a quote unquote conspiracy theorist. And I'm sure a lot of folks here in this conference know the origins, the historical origins of the term conspiracy theory, invented by the Central Intelligence Agency in the mid-60s to call into question those majority of Americans who had doubts about the official Kennedy assassination story. But the phrase conspiracy theory continues to be weaponized and used against anybody or any organization who questions official narratives. And of course, there's a huge kind of conversational universe between an official narrative and a conspiracy theory. And that's the space we want to occupy. That's where we want to be as good critical media literacy practitioners and good netizens who are skeptical, even as we try, and people are dying and people are scared, but we have to hold that conversational space. You're absolutely right, Amber. We need to do that.
Great, Rob. I value where we're going with this conversation, because I think when we start stepping out of what we believe in as the official narrative, we kind of look around like, what do we trust? Where do we go now? And just want to take a moment to ask you, what do you trust? What news platforms or people or places that you feel like you can put your trust in around these topics?
In the Post-Truth World book that I wrote, and I'm happy to make available free of charge, e-copies, contact at drrobwilliams.com. What I write about is rather than putting our trust in news channels or personalities or outlets exclusively, we need to train ourselves to treat each story or each pandemic on a case-by-case basis, and to sort of crowdsource your own evolving understandings of a major news event.
Yeah.
This pandemic is really important. A, you realize you're not alone. B, you realize everyone else is trying to figure it out. And third, you have a chance, as you just said, Amber, to really engage in sustained conversation about this. And that's us being team human. Like, my concern is that we will get too accustomed to Zooming. Too accustomed to team human in virtual life rather than being face-to-face, sharing electrons, right? Like the quantum physicists say. We are only fully human in each other's presence. Like we need, and we're gonna need, local and regional news like never before as we move through, right? This, not only the pandemic, but this kind of economic devastation that we have by policy decided to impose on the United States. My favorite example right now, Ben and Jerry's ice cream, our most iconic, probably Vermont company, now owned by Unilever, has committed to investing weekly, sending weekly checks, I think it's weekly, to local newspapers and news outlets to sustain local news through the pandemic. And they're taking out full page ads in newspapers saying, look, we need the papers more than ever. We're willing to help support them. We hope you will be too as small businesses come back online. I would be remiss if I didn't say that we should all be practicing practicing critical media literacy education. Access, analyze, evaluate, produce media, cultivate knowledge, skills, activism, look at the trade-offs in any media story and media platform. And number one, practice skepticism, not cynicism, but skepticism. And the opposite of crazy conspiracy theory or official narrative, right? You have these two polarities, right? The sauna and the ice bath. The opposite of those is that universal sweet spot of complexity and kind of humanness in the middle, right? Let's all go like this.
Yeah, everyone go like that.
I love that.